Dr. Sana Nazir, consultant gynecologist and fertility expert at Australian Concept Fertility Center. First of all, I would like to say thanks to all of you to come here. Today, what we are going to do, we will discuss the unexplained fertility, and I don't want to bore you and exhaust you. We will make a healthy discussion, and I would like some of the answer from you. How does it sound? Okay, so my first question is what is unexplained infertility? Anyone wants to answer this question?
And we don't know the reason.
Exactly, excellent. So this is a condition in which we don't know the reason. Actually, the preliminary tests are normal. When the couple is not getting the pregnancy for the 1 year with regular intercourse, and we will do the preliminary test, and these all are normal, then we will call it unexplained infertility. So this is the definition that I have explained you. Now, what is the incidence? It happened in the 30% of the cases of the fertility. Total. Alright. So this is the percentage that I have told you. Sorry for inconvenience. So what are the preliminary tests? These are the 3 tests. One is the semen analysis, it should be normal. Second is the tubal test that shows that the tubes would be open. And third is the ovulation that we can check from the 21st day of the progesterone level in the mid-luteal phase. So if these all are the normal, then we can say that this is a case of the unexplained infertility. So now the question is then what are the reason and the contributing factor for the unexplained infertility? Anyone would like to answer this question? No problem. Before discussing these, what are the causes, I would like to share one of the video that is very good regarding the conception, stating that conception. So look at this video and we'll find out what are the contributing factors for unexplained infertility.
Race. Starting with millions of sperm, only one, the fastest and the strongest, will reach the finish line. Some fall out of the race, getting lost in the rush through the narrow fallopian tubes, while some are stopped by natural obstacles which protect the woman's body from intruders. Those who make it closer to the end compete fiercely with each other. Together, they attack the egg cell. Their only goal is to be the first one to enter the egg. Only one will make it through, but the others simplify this mission by slowly dissolving the membrane of the egg. Finally, we have a winner. The winning sperm enters the egg and conception occurs. Half the man's and half the woman's chromosomes combine. This creates a unique DNA code which is needed to create new life. These combined chromosomes form the first cell of the new baby. This is now called the zygote. The zygote starts to divide into a cluster of cells and begins to travel to the friendly and safe habitat of the uterus. When the zygote is divided into a bubble of cells, a blastocyst is formed with an inner layer of cells making up the embryo and an outer layer which will protect and nourish the embryo. The blastocyst then finds a comfortable place to stay in the uterus for the next 40 weeks to develop and transform into a human being.
Alright, so after watching this video, we can see and I will discuss with you what would be the contributing factor for the unexplained infertility. The supreme factor is the aging. If someone is aging like 40 years old more than that, what will happen? There is a significant decline in actually the ovarian results. So this is one of the most important factors. Apart from that, we can see in the video that the sperm swim up and they will pass through the cervix, and cervix has the cervical mucus. Normally, the cervical mucus is actually play a role and helps to swim up the sperm. But in 3 to 5% of the women, what happened that cervical mucus actually damaging the sperm, and it is called the cervical mucus hostility. So, what would be the reason of cervical mucus? Why it is doing so? It could be because of many reasons. One, subclinical infection could be in the cervix. Second, we are giving some of the medicine that are very common from. What it will do, it will actually reducing the cervical mucus secretion. And also sometimes in this mucus, some antibodies against the sperms are present. That could be the reason of the cervical mucus hostility. So this is the second. Third one is the tubal function defects. We know very well open tubes are very important, but the function of the tube is also as much as important as it should be open. So what is the function of the tube? Anyone can answer this? Okay, no problem. Actually, there are the two function of these tubes. One is that the ciliary motion, and the second is the muscular activity. We have seen in the video when the sperm swim up, they will go towards the tube, and what happened? Egg is coming from the ovaries and in the tubes. So in the tube, the actual interaction of the egg and sperm will happen, and this ciliary motion and also the muscular activity is actually play a vital role here. And what they do, they will help interact to make the zygote, and when the embryo will be formed, it will help to transfer the embryo from the tube towards the uterus. So this is the main function, and this is should be important in the case of infertility. So now the question is, what are the tubal function defects, and what are actually the reason of tubal function if deteriorate? There are the different reasons for that. Sometimes what happens, we have started a very simple Neisseria, gonorrhea, and also the chlamydia infection. They will actually not close in the start. They will not just close the tube. They will disturb the ciliary motion of the tube, and that could be one of the reasons that the couple is not getting the pregnancy. So in that case, always check the discharge, and you can treat it. After that, there are some like abdominal surgeries and also the endometriosis. Sometimes what they do, they will actually causing the scarring and also disturbing the function of the tubes. And it could be the reason of the tubal function defect. Am I clear so far? Any question till now? Is it boring? Should I change this slide? Or is it interesting? Thank you so much. So other factors are oocytes defect, sperms defect, fertilization defect, and implantation defect. And some are the immunological factors. These, just like these are the from here, this oocyte defect, sperm, fertilization, implantation. Why this is happening? There are some lifestyle changes that we are talking. For example, smoking, alcohol intake, that is not here more, but alcohol intake. Also the obesity. These are actually play a vital role of defects of the egg, sperm, and also it's not only this, it's also affecting the fertilization. We have seen in the video that the sooner exosome reaction would happen when the sperm will enter the egg. So these all will actually affect it with smoking, alcohol, and also the obesity has a main role in the implantation. So these are the factors that we should address or we should know before counseling the patient of the unexplained infertility. Why? Because when the patient is infertile and we will go and we will explain that your tubes are open, semen report is normal, it will a little bit confusing for the patient, and the patient and the couple will be sometimes frustrated that although they have already sense of incompleteness, but when they came to know all the reports are normal, then we need to tell that no, there are some other reasons that we need to address that to calm the patient, to counsel the patient, and that will actually improve couple mental health. That is a vital role in the success rate of the fertilization. Like this endometriosis, if someone has a asymptomatic, no any problem, but on the diagnostic and laparoscopy, we will see there are some spots of the endometriosis. It can also disturb the function of the fallopian. So these are the factors, and this is very important slide. Now the question is, what are the treatment options for the unexplained fertility? According to ASRM, that is American Society of Reproductive Medicine, they said that as we don't know the cause, that's why the treatment is empirical, depending on our clinical experience. Okay, so what are the categories of the treatment? One is the expectant management, ovulation induction, intrauterine insemination. Third one, with or without ovulation induction, and the fourth one is in vitro fertilization. So my question is, do we need to do the ovulation induction? Any answer? What the ovulation induction will do? It will just ruin the ovulation. So the unexplained patient infertility patient is already doing the ovulation. So that is the thing. That's why this ASRM society will give us some of the suggestions. Some are the recommended options, some are not. We will discuss one by one. First, I would like to discuss expectant management. That is do nothing, just counsel the patient and advise them some of the healthy lifestyle. That could be fruits and vegetables. We will advise them, and also some sort of this is the fertility food that boosts the fertility. What are these? We always counsel the patient about the food. So this fish is very important. It plays a vital role in the egg quality and sperm quality, and also the quantity, and also the eggs, especially the nuts, dry fruits, almonds, dates. These are very important. Apart from this, there is the Mediterranean diet that also includes olive oil, and also they will advise to take up plenty of water and also do the rest at least sleep should be of the 9 hours. So these are the lifestyle modifications, including quit smoking, can play a very important role when we are doing nothing and we are just doing that practice. Okay? Am I clear so far? Alright. So now coming to the active management or artificial reproductive techniques, I would like to tell you what are actually recommended by ASRM and what are not recommended. As I have told you that this ovulation stimulation with anything, with the clomiphene, with the gonadotropins or with the letrozole, actually is not recommended. Because now we have no deposit, ovulation is already doing, then what would be the advantage of that? And this is the IUI in the natural cycle. It's also not recommended because the randomized control trials show that IUI in natural cycle will not give you the best result. So clomiphene and letrozole, these IUI is the good option, realistic option, and it is recommended by ASRM. Even gonadotropin with IUI is not recommended. Why? Because it is also showing the same levels. But these are the randomized controlled trials that shows that clomiphene and letrozole versus gonadotropin both have the equal result. So that's why we will avoid the patient to give the injection if we are taking advantage of the oral medicine. So this is the last and the best treatment we know very well. That would be the IVF. So we will discuss further. So, in summary, what would be the best treatment for the unexplained infertility? Best initial therapy for many clinicians is actually a course of typical 3 to 4 cycles of ovarian stimulation with IUI, either with clomiphene or citrate. And if it will not work, then we can go for the IVF to get the best result. But whenever we will make any of the decision regarding the protocol of the treatment, we should consider the 3 things of the patient: age of the female, duration of the self-fertility, and also the previous pregnancy. This is the most important age. If some patient will come after the 35, we can suggest the expectant management. But if patient will come after the 40, we need to do the work as fast as possible and we need to go for IVF. just one episode if we would like, and the best treatment would be IVF. Because with the aging, the result would be negative. All the cases we will go for that. So this is very important. Always. This is the role of IUI, and we can see in IUI what we do. We will just pass the sperms that are the washed and processed sperms from the cervix, and that will be enter in just 2 centimeters below the fundus. We will insert that. So what we are doing, we are actually bypass their cervical secretion. That could be one of the reasons. Am I clear so far? Any question? Okay. So this is the IUI. Now this is simple. The IUI definition that it involves the placement of the washed sperm into the uterine cavity around time of ovulation. So what would be an advantage of IUI, especially as compared to the? It is less invasive, less stressful, less time consuming, and also less expensive as compared to the IVF. So it is the real and realistic approach for many patients because our social issues, patients, especially financial issues are there. So it is the better option for that patient. Now this is the cannula, and this is the procedure that how we do the IUI. We will put the best sperm, processed sperm in that syringe, and then we will put into the fundus. Sorry, I'm very sorry for that. We will insert it 2 centimeters away from the fundus. So the success rate of IUI is 9 to 15 per cycle attempt. So this is the international success rate. Now coming to the best option for the unexplained patient, that is IVF and ICSI. Why? Because we have seen they are the defects of the egg, they are the defects of actually the sperms, and they are the defect fertilization. We can't see, we cannot do any test for that. But this IVF is actually the diagnostic test for that unexplained purpose. Why? Because we will see, our embryologists will see that the sperms, what do they do in IVF? Do you have a concept of IVF and ICSI? What are the differences in that? So we will discuss about that. Actually, why IVF, actually what it will do, we will just mixing the sperms and eggs in the laboratory, and we will see and we allow them to fertilize spontaneously by themselves. Okay, so here, how is the egg, whether it matured after the pickup, and also the sperm, what is whether any defect, and how they are fertilizing, whether they can fertilize or not, they can be diagnosed by the IVF actually. So unexplained infertility, the diagnostic could be IVF itself. Okay, or this is ICSI. It is actually the advanced form of IVF. And what we will do in this ICSI, we will just put one sperm by the syringe into this egg. Can you see this? This is the egg, and this is the syringe that we are putting one of the sperm in that, and this is called an ICSI. And these both actually give the best result for the unexplained infertility. And that's why nice guidelines say that always go for the IVF if the patient has passed 2 years of infertility. So, but the thing is, all clinicians have their own choices according to the circumstances. And we know that the success rate of the IVF is almost 35 to 40%. There are some side effects. We can say one, that we are giving the medicines. What are that? That is ovarian hyperstimulation syndrome. But don't worry more about that. And if you need any help, we are giving OHSS also very frequently. And alhamdulillah, we don't have any spare form of ovarian hyperstimulation syndrome in this center. Because what is the reason? We always monitor the patient very, very frequently. Do the scan regularly on daily basis. So if we will see and we will see that if the patient is going for the OHS, we will just reduce the dose of the medicine. So that's why the results are not so high of that. So multiple pregnancies, sometimes the patient is happy for that, but we know that for this reason, the complication of pregnancy are actually increasing. So my take-home message is we are the doctors, especially the gynecologists, who are actually the front doctors that are dealing the infertility patient, not the IVF center. We can see that all the patients, when they have the problem, they will go to the straightforward gynecologist. So as a gynecologist, what is actually the main thing that we need to do? First of all, we need to take the confidence of the patient. Tell us, tell them that we have seen that you don't have a problem in millimeters, but what could be the reason? One by one, we need to tell so that we can advise them right treatment in right order and also prevent them from entering into the vicious cycle of the ovulation induction again and again. That will not beneficial at all. And instead, it will actually wasting the time of the couple, creating the social issue, affecting the mental health, and also with the aging decline of baby result. So this is my take-home message, and I always this is my wish for whatever that we should work as a team. Gynecologist IVF center. If you have a patient of unexplained fertility, you can come and you can do IUI by your own in our center. And after that, if that will not the result show the positive, then you can refer for the IVF also. And when the patient will be positive, then the patient can go back to reverse you for the antenatal care. So this is a message, and we should do the work as a team, and so that we can give the best result to the patient. Thank you so much.